I would suspect that if it's a simple, straightforward rupture repair with early range of motion rehab and splinting, he should be good to go. So New Orleans Saints, Drew Brees, what's going on? Why is he checking his grip at the end of that play? I don't know what's going on, but the New Orleans Saints, they've had some weird endings. Not so fortunate. I'm not sure who their saint is, but now they have something that may not be the best beginning to their season. Let's take a look. So here we have it again. We got that play. You guys all saw that. And we're going to zoom right to where his injury happened. So watch this. He's about to throw. Okay, he's about to throw. And then this hand comes right there. And you can see his hand going like this. Now looking at it from the other view, it looks like his thumb got taken out. Now let's pause there. So what's happening here? So what we do see is that the on-site physician is examining his MP joint of the thumb. And when he's looking at the thumb, he's isolating this joint here. So he's holding the metacarpal from one side, the phalanx, the proximal phalanx, there's only two phalanges in the thumb. So the proximal phalanx and the metacarpal form this MP joint. And so what he's doing, he's testing the stability of the MP joint. And there's the ulnar collateral and the lateral or radial collateral ligament. This ligament seems to be the one he's testing out. So let's take a look at what's going on. This is the metacarpal. There's the proximal phalanges of the thumb, okay? Now, clearly this is the right throwing arm, so we're looking at the right thing, okay? You just saw what I did on my left thumb. This is the right thumb, which is what he's looking at now. Look at here. Now look at here, okay? Metacarpal, proximal phalanx, MP joint. So you see him holding right here and he's testing, okay? Now, in this particular case, you can go like that and it looks terrible. Now imagine if that's what happened to his thumb. In order to do that, the ulnar collateral ligament has to rupture. Now what happens when the ulnar collateral, now you could do the radial collateral, and what he's doing right now, he's going like this, checking the stability in slight flexion and checking the stability of ulnar collateral, radial collateral, back and forth. And in this moment, you'll see specifically him checking the ulnar collateral ligament. Watch it now. Basically, he's testing the ligament. And when you have a rupture of that ligament, you can have the rupture of the ligament, but sometimes you can also get this thing called a Steiner's lesion. And once you get that, it's actually the adductor that sometimes gets stuck under the ligament when it tears. I don't want to complicate it, but all I can tell you is imagine if a ligament tears and a tendon gets stuck underneath. So then if that's the case, the ligament can't heal because something's sitting underneath it. That requires surgery, and that's unstable, and that needs to be explored and investigated. Could it mean surgery? Is he having surgery?
Yeah.
He's having surgery. It would require opening this up, taking the ligament, and putting it back on the bone where it's supposed to be. Now, sometimes you could have other problems. Could there be cartilage? Could there be a microfracture? Could there be a small fracture? Could there be some cartilage injury? There's a lot of things, osteochondral fragments or just a cartilage fragment. A lot of other things that could complicate this, but hopefully not. Hopefully it's just a strain, significantly or a significant rupture where you don't have this Steiner's lesion and it heals. If it's a true Steiner's lesion, then he will have surgery, and it's not just about splinting and recovering. Now, these are performance athletes, so could they be getting some other adjuvant treatments such as PRP or bone marrow or stem cells or other things stateside or in Europe possibly? There's a lot of things that could be happening. If he had an associated fracture, could he be getting other adjuvant therapy for that? We don't know. But the most important is he going to get back in the game and play? So 6 weeks is what they're saying for recovery after surgery. Now it takes about 6 to 8 weeks for the ligaments to heal. Now the thumb, the hand, pretty vascular, heals pretty quick. He's an athlete. He'll get all the vitamins, all the nutrition, and any other adjuvant treatment that we talked about, possibly yes or no. It all depends. I have no idea, but as performance athletes, they heal better than we do, certainly better than I do. Oh, you didn't realize? Oh yeah, I'm not a performance athlete. I'm just an orthopedic surgeon that likes to talk about this. Yeah, don't worry. I've cleared that up for you. Yeah. I may look like a performance athlete, but I'm not. Okay. So 6 to 8 weeks is what he's doing for the healing, right? And so if he comes back, they do a repair, they splint him, get him moving, and then they can start early range of motion and strengthening, and probably I would suspect that he may have to go back in a splint back into the game. But that really depends on a lot of different factors, and 6 weeks is sort of a guideline. Let's hope it's that early, and I hope so. I mean, I would suspect that if it's a simple, straightforward rupture repair with early range of motion rehab and splinting, he should be good to go.